Okay, so let's begin again. So what will happen uh, when how alcohol work in the brain? Basically, we are talking about. So as the central nervous system act as a okay. Sorry guys. So let's continue again. How alcohol work in the brain? Basically, we will discuss about the central nervous system act as a difference. So basically, what happened? Alcohol act as a dispense which slow down our central nervous system or brain cell activities, which affect its communication through between the brain cells. What will it do? It enhance neurotransmitters, which inhibitor effect on the brain means that makes the brain less active. So, what are its initial effects? So, basically, relaxation. That is, alcohol can make you feel relaxed and reduce the stress and the anxiety level. And second effect is lower inhibitory. That is, it also lower the inhibitory by inhibition of the affecting of the brain responsible for involving in decision making and self control, as it affects our prefrontal cortex. So its example is more talking, confident, or taking risks. These are all the examples of what the happen when alcohol acts on the brain. Then we are talking about the neurotransmitter interaction. Before that, we will show some video regarding this. Just a second, guys. Okay. First of all, we listen about the video. Okay. Okay. So, how does neurotransmitter interaction? So basically, it involves the two things, that is the increase of GABA activity, that is gamma amino bio, that is gamma amino butyric acid, that is GAPA, GABA activity. And second thing is decreasing glutamate activity. So basically, what happens when alcohol affects the brain? It increases the GABA activity. What happens when this activity increases? It's calm down our brain activity and make us feel relaxed and less anxious. And at the same time, it decreases glutamate activity, which usually helps in stimulating the brain functioning such as learning and memories. So basically, this increase or decrease leads to or can result in sluggishness, poor memories, or slow reaction times our body can face during the consumption of alcohol. Okay, so our next slide is short-term effect of alcohol. So what are the effects basically? You can see impaired judgment means it affects our frontal lobe that is helping in decision making, judgment and impulsive control. Increase in likelihood of a poor decision and risk behavior. Also lower down impaired consequences, evolution and can lead to dangerous actions such as drink and drive, unprotected sex and all. So these are the impaired judgment. Means our body is not able to making a decision. Next is memory impairment. We get some blackout due to a temporary memory loss due to heavy alcohol consumption. So a person may not able or unable to get a new memories normally functioning. It also disrupts our hippocampus and leads to a memory gap lasting forever a minute. As you see, some people are not able to recognize what they had done few hours ago due to the effect of alcohol. Reduce coordinations means alcohol affect the cerebellum, which control motor skills and balance. Interference within area leads to impairment condition, unsteady movement, or clumsiness. Slow reaction time make tasks such as walking, driving, hand-eye coordination. So all these type of coordination get disturbed as our cerebellum get affected, which makes some balance or control of our motor neurons. So moving to our next slide, that is a long-term effect of alcohol. So what are the long-term effect of alcohol we're discussing here? That is the brain shrinkage, that our chronic alcohol can reduce brain volume of the frontal lobe, which is essential for decision self-control as behavior, impaired memories and judgment. Next one is cognitive decline. That is prolonged alcohol can damage our hippocampus, means it can affect our learning as well as decision making, or also affect our frontal lobe memories, leading to difficulty in learning, memory recall, and cognitive functions. Some mental health issue that are not able to balancing our body, regulating our moods, developing depression, anxiety feeling. So all these are all effects of the long term when we consume alcohol. What are alcohol use disorders? So these are the condition characteristics by an inability to control alcohol consumption described of a negative consequences. So basically what we will do, we have some criteria to recognize them, such as drinking more and long intent unsuccessful attempts, spending a lot of time, stop cravings, neglecting responsibilities at work, schools, continuing drinking problem despite in relationships, giving up activities once enjoying during driving, drinking in a dangerous situation, developing a tolerance need to more alcohol effect, or experiencing withdrawal symptom when we're not drinking. All of these are the criteria which are diagnosed due to continuous consumption of alcohols. So these all are these effects of the disorders. So our next is the risk factors. What are the risk factors? Genetic, that a family history of alcohol using disorder increase due to inherited genetic predisposition, some environmental, social, cultural or peer influence, some personal behavior, getting some habit of alcohol consumption or individual choice. What are the symptoms basically we get? That is a craving, loss of control, physical dependency or tolerance. Means a person is getting a strong craving of getting alcohol. We are not able to limit our alcohol once we drink. Some physical experiencing some withdrawals and symptoms, or need more alcohol to get the same pleasure effect. Alcohol and mental health. So basically, alcohol act as a coping mechanism. It may get a temporary relief from stress, anxiety, and depression. So what is to it give you short-term relief, means you get happy or you may get some relaxed feeling from the stress, or long-term consequences such as mental health issue, some emotional distress, and increased risks such as disorders, or how to individuals are not able to manage the stress, anxiety, and depression effects. The cycles of alcohol and depressions. So basically, it's have a four stages, that is a neurotransmitter disruption, worsening symptoms, impaired coping, and cycle of dependency. So what is true? Alcohol can disrupt brain balance of a chemical, which leads to a feeling of depression and anxiety. And regular use of these making extending mental issues or worse to handle these conditions. It also slowed down our inhibitions or impaired judgment, which affect through a leading of bad decisions, unhealthy way of coping strategies, or making some mental health issues. So this created a cycle where people can drink more and more, escape from the feeling, and lead to increased alcohol dependency. So this is the cycle of alcohol and depression. How alcohol and depression are for each other. What are its treatment? Behavior therapy means counseling or group therapy or sport therapy. It includes some medication, some disulfiram, naltrexone. These are some medicines which could be used, or some research use genetic testing to optimize the therapy of individual of a drinking. So all these are the treatments. So basically, getting educated or spread awareness regarding this is the most important thing nowadays. Moving to our third topic, that is nicotine. So what is the nicotine basically? It is a highly addictive substance found in tobacco products like cigarettes, e-cigarettes, and chewing tobaccos. It classifies as an alkaloid, act as a stimulant in a small dose. Prolonged use of nicotine can lead to some, as you know, addiction. That is the basic thing. Or cardiovascular problems, some respiratory disorder, or increase certain some cancers. So these are the basic structure of the nicotine, and its general formula is C10, H14, and 2. This is the basic structure of nicotine. So basically, how does it reaches to our brain? So it's basically a 10-second process. So what happened? It includes these five steps, that is inhalation, absorption into bloodstream, transport to brain, crossing blood and barriers, ac- activation of receptors or systematic effect. So basically, what happened? We are talking about our first step, inhalation. When you smoke or nicotine substance get absorbed into a tiny air sacs present in our lungs. So it get inhaled by the lungs, alveoli. Next is absorption into the bloodstream. So nicotine enters to the bloodstream and binding with RBCs and plasma protein. It can bind to our red blood cell and plasma protein. Next, it's transported to the brain. It travels to the brain and it reaches in about 10 to 20 seconds of inhalation. When you inhale it, it reaches to the brain within the 10 to 20 seconds. Crossing blood barriers. So it, it is dissolving fat. Nicotine easily passes through the protective barrier that keeps safe the brain. So it gets soluble as in a fat easily. So it get transported or it get cross the blood barriers easily. Activation of receptors. So in brain, nicotine connects to a special receptors which is known as acetylcholine receptor. These are the short forms: acetylcholine, nicotine acetylcholine receptors. What it's do, it release dopamine and make you feel pleasure. Last is systematic effect. So its effect basically nicotine stimulates the nervous system. It affects the mood, heart rate, blood pressure, which leads to addiction. So all these process it basically 10 to 20 seconds you get addiction of nicotine. Moving to our next slide. How nicotine affect brain. So for this we need to watch the video. Okay. So basically, how it affects the brain. So nicotine binds to receptors in the brain and release dopamine, which give you pleasure feeling. So what are its effects? It has a short-term and a long-term effect. What is a short-term effect? That it increase a feeling of more alters, constant affect our concentration, or act as a temporary mood booster. And what are the long-term effects? Long-term effects might be they cause addiction or change some brain chemistry or leads to more memory or alternate impairment, such as affect our cognitive functions. Moving to our next slide. Okay, that are the health risk and treatment. So basically, what are the health risks here? That using nicotine increase anxiety, depression, and other mental issues. It also linked to some diseases like strokes and other neuro disorders. Basically, what are its treatments? It's nicotine replace therapy. Nowadays, we are using some gums or some patches to reduce the by providing small dose of nicotine by using the treatment of withdrawal symptoms. Some medications such as Bupropion and Vaseline prescription as a drugs to reduce craving and withdrawal symptoms. Some behavioral therapy that counselings or some group supports are also help in the treatment and changing obviously the change in lifestyle health habit or exercise by getting balanced nutrients, so all these may be a good in the treatment of nicotine. Moving to our next slide, that is cannabis. So what are these? Cannabis is a plant that has been used for a various purpose of thousands of years. So basically, it contains 100 different cannabinoids chemical compounds. So here we are discussing about the two, that is THC, that is tetrahydrocannabinol, and CBD, that is cannabidiol. So these are the two cannabinoids. So basically, it used in a medicines such as a pain relief, reducing nausea or vomiting, stimulate appetite, managing symptoms, condition like of epilepsy, multiple sclerosis, and a chronic pain. Its example is marijuana, and it's a structure of THC, tetrahydrocannabinol. So, what are its short-term effects on the brain when we consume it as an when we get addicted to it? So, basically, it's altered prescriptions, that is, change in sensories or sense things such as your mood or your thinking. Some memories and learning shorten our memories and learning get worse, or some coordination and reaction times it slower down our reaction time and cause trouble in movement. Some psychological effects, such as some people feel more anxiety or some paranoid. So these are some of the psychological effects. So what are its long-term effect and risk? So basically, cognitive functions means using a long term in hard thinking of clear or hard some our school performances if you are in young age, or a mental health to increase our mental health issues problems, sometimes of serious conditions such as a depression, or sometimes serious conditions such as psychosis or dependency and withdrawal. Means there is a chance of being dependent, or it might be hard to get withdrawal or without feeling bad. So neurodevelopment effect. So basically it affects our brain development in basically in the youngsters. You can see those youngsters who are consuming this. So their brain development might affected. So what are its treatment? Basically awareness, education, some counseling therapies, sports group to join support different groups, and some medical treatments and some behavior strategies. So these are its treatment and managements. Moving to our next slide, that is amphetamines. So what we are discussing here in this, so basically these are the synthetic stimulants that affects our central nervous system. These are the commonly adrenaline, methamphetamine, or some NDM. So these are the structure of amphetamines. Basically, its general formula is C6H13 and N19. How do they get it? Basically, increasing the level of neurotransmissions or dopamine, or result in the enhancement of alertness. Okay. So, what are its effects on the brain? So, some short term effects, that is increasing heart rate, blood pressure, elevated mood, some heightened energies, reduced appetite, and enhanced focus or alertness, mood alertness. So, that is long term effect. It might cause addiction or dependency, risk to neurotoxics or some cognitive defects, damaging to dopamine, serotonin systems, or some psychological effects, that is anxiety, paranoid hallucination, you get it. So some mood swings, that or also some irritable. These are all are the effects of amphetamines on our brain. So what are the risks? That is addiction and dependency, means high potential to misuse, some kinds of withdrawal symptom, fatigue, depression, increased appetite, health risk, cardiovascular problems or neurological issues, maybe memory problem, cognitive decline. Some safety tips are we can prescribe to our healthcare profession, avoid recreation uses or being aware our society about it. So, talking about heroin. So basically, it's an illegal opioid or morphine derived from morphine, that is from a poppy plant, as we discussed it earlier. It's taken in the form of powdered or the stick black substance. It may be injected, snorted, or smoked. Its journal formula is C21H23NO5. How it affects our brain. Some immediate effects, such as intense pleasure feeling relaxed or sleepy, some nausea, feeling brain chemistry, that might be endorphin release, that is heroin act as a natural chemical in the brain that is called endorphin and changing how the body feel pain or affects the mood. Dopamine surrogacy, that it increase the dopamine level or control the feeling of pleasure and reward. Some long term effect, that is addiction, means you craving of the drug again and again. Cognitive decline, that is loss of memory, long term, or some decision making or concentration. So, what are its risks? That is brain damage, mental health issues, overdose leads to slow breathing or may cause death, social legal consequences, addiction impact your relationship, your academic or professional life. Some legal issues means as it is an illegal drug, so you may get arrested. So all these are the side effects or the risk or the consequences. Moving to our last topic, that is cocaine. So basically, cocaine, what is it? It is a powerful stimulating drug derived from a coca plant leaf. It's primarily affect our CNS, that is central nervous system. Is here you can see its structure and its journal formula is C17H21 and O4. So how it is used? It may be snorted, injected, or smoked. These are rapid effect and high abuse potential. Immediate effect, that is a short term effect, may feel you pleasure, increase energy, heightened alertness, or increase heart rate and BP. So how it affects our brain? Its neurotransmitter impact. Basically, cocaine stop dopamine from reabsorption, which is a chemical in the brain that make you feel good, pleasure. Or these cause a large buildup of dopamine, leading to intense pleasure feeling. As you can see here, it blocks dopamine and increase more dopamine here. So brain area involved, cocaine may affect the brain reward system involving the part of nucleus accumbens, prefrontal cortex, or ventral tegmentic areas. So it's long-term changes. What happened to the long-term changes? With the repeated use, brains start making less dopamine naturally. This can lead to addiction, depression, or make difficulty in leading to pleasure without drugs. So, what are risk, addiction, and dependency? You can see cognitive impairment, poor decision making, loss of memory, some mental health, anxiety, paranoia, some hallucination, or some mental disorders such as like depression, or may cause brain damage, strokes, permanent brain damage, reduced blood flow, and so on. So, what are its treatment? Behavioral therapy, that CBT, understanding the thinking of the partner. It includes some medications such as disulfiram, tropomatin has a slow potential to reduce craving. Some group supports is a very important nowadays. Rehabilitation program, prevent relapses, or you last one is to get educated regarding this, spread awareness. So that's all about our drug topic. Thank you very much for attending the session. Thank you guys. You can leave now.